So we're going to start now with our first skill. So we're going to spend about an hour on teaching you some effective ways to ask questions. And then we'll start with intro to reflections, and then we'll do change talk. And those are the three skills we're going to focus on: effective questioning, the general application of reflective listening, and then the specific application of using it to build change talk. So let's start with open questions. I'm guessing almost all of you who have had some clinical training, social work, nursing, know the basic difference. So I'm going to ask you, what's an example of an open question and what's an example of a closed question? Who would like to give one of each? Go ahead. What's an open question? Why are you here today? How do you feel today? What are your thoughts about? What's a closed question?
Do you feel angry? Do you feel angry?
Good. So in very simple terms, closed questions tend to start with these types of words: did you, will you, can it, is it? And open questions tend to be seeking elaboration. Closed questions are structured to elicit a yes-no answer. It turns out that most closed questions actually do not elicit only yes-no. They do elicit some of the story, but this elicits more of the story. So this is referred to this because this does push the person towards yes-no, and often they disobey that subtle message and they do elaborate. But nonetheless, if our goal is to get the person's story as fast and accurate as possible, open-ended trumps closed-ended. Now, we're going to do an exercise in a few minutes where you're going to practice constructing some open questions. When you do that, we'd like you to pick one or two of these you currently don't use. I'd like you to specifically reach beyond your current repertoire and find a new one here. So everybody, if you can, write down one or two that you currently do not typically do. When, if ever, how, if at all, are the two most common ones that people don't use, but you're welcome to pick any of them. The next strategy I want to talk about is what we call the long open. This question is reserved for a very specific subset of circumstances. I do think it's relevant to your studies, so we are going to teach it. I'm going to start by comparing a long versus a short open question, and I will explain. It's not intuitive, so don't worry if you're lost. I will clarify it right now. A short form of a question might be, what are your thoughts on homosexuality, or what are your thoughts on gay marriage? Do we all agree that's an open question? Do we all agree that that qualifies as an open question? Yes? For that specific topic, and we're choosing the topic quite intentionally, we would recommend the long form. And the long form would sound something like this. Some people feel that homosexuality is a sin, it's an abomination, it's forbidden by the Bible. Society should do what it can to stop it. On the other hand, other people feel it's a normal part of human sexuality. Society should protect this normal biologic function, and society should do whatever it can to protect these individuals. What are your thoughts on this? What do you think about it? What is the benefit of saying some people think it's this way, other people think it's this way?
To get their true feelings, because you're not saying one answer is wrong as opposed to the others.
Right. So if I may paraphrase your words, what the long form does is it normalizes every response. It gives the person permission and safety to answer in either direction. One of the classic problems is if you ask, what are your thoughts on homosexuality or gay marriage? The patient or the respondent might start to match the response to what they think you want. So if they think you're from Ann Arbor, they're going to assume, oh, no one in Ann Arbor could possibly be anti, so I'm going to be very accommodating to my doctor. And we don't want people editing their responses. So when we have charged topics, the long form helps minimizing the patient customizing their answer and therefore inhibiting the truth. Another example would be, what are your thoughts on abortion? It's a good open question. It meets the qualifications of a good open question, but it is a similar topic for which there are strong feelings on both sides. People get angry, people get worried about not creating an argument. So we would say some people feel abortion is murder. It's really bad. Society should stop it in every possible way. Other people feel no, it's up to a woman when and how she reproduces, and society should protect that right. What are your thoughts? a couple things about this strategy. You have to be balanced. If you say some people feel homosexuality is a sin, it's forbidden by the Bible, and it's an abomination, other people say no, that's not balanced. So you have to try to come up with a relatively neutral presentation of the two polar opposites. Number two, you don't want to in any way tip your hand that you prefer one. So you have to be in what we call equipoise. You have to have the ability to present it neutrally. It's a wonderful way to attack complicated, difficult topics. So now is the tough question for you guys. Where in this study might you want to use the long form? So where in this study or this type of patient might we want to be cautious to tell the kid it's okay either way? I've heard it all before. Don't worry about being right or wrong. Where are we touching on that sort of stuff? Where might it be better to ask it in this way than the traditional open-ended way? Well, there's a lot of potential stigma here, right? There's a lot of potential of what could be embarrassing information or information they're worried about sharing. So what's some information they're worried about sharing? So drug use. So how could you take advantage of this question to probe substance use? Let's say the kid came in with a high blood alcohol level, okay? You could say, what other drugs are you using? That is an open-ended question. Does that feel autonomy supportive? So I'm going to spoon feed you. How would you probe what other drugs he may be using the long form? I'll start it. You guys have to finish it. When we see a kid come in with an alcohol level like this, we often want to know what else might be going on. Some kids, this is the only time they've ever had a drink. It's the only drug they've ever used. On the other hand,
some kids have a lot of problems, or some kids use a lot of drugs. They might, and then you could list them.
yeah, some kids when who come in with this black level might be drinking a lot. They might be using other drugs. They might smoke weed. Tell me about it for you. Okay, so you could use a normalizing polar question to lower the pressure of them as opposed to what other drugs are you using. And I'm not saying you would ask that, but that would be an example of an unnecessarily blunt, open question that we feel could be perceived as controlling. Where else? I think, yeah, go ahead.
You mean we can't say, you better tell us now, it's going to show up in your drug screen anyway.
Yeah, but there's stuff that
We
doesn't
hear
show.
that.
So
It's true, I've heard it said before.
Every day.
there's actually a really interesting nuance to that. So the drug world actually wants to know, and I know you were doing it for a different goal and I like it, but how do you use biologic feedback that is discrepant with self-report? So there's actually a whole MI strategy of using this very innocent tone, like, so I understand that you're not using any drugs, and then this is the only time you ever had alcohol. We do have this test, and the test shows there may be a little bit of cocaine in your system, and there may be a little bit of THC, but I'm just curious, is this surprising to you, or is this, maybe, and it's this innocent bewilderment tone, so you're not confrontational.
Right.
Where else, though, in this study? I want to see, I think there's several other areas, in addition to the substance use part. What about the partner violence part? Where do you see the pressures? Like, how often do you beat your girlfriend? I'm not saying you would ever say that, but that's not going to work. So who would like to come up with we mean bipolar, but we're being slightly comedic, a bipolar way to ask this question? So when we see, I'll start it with, you guys have to finish it. When we see someone come in, I see you had a fight with your girlfriend. When we see that, sometimes that means,
Sometimes it's happened once, and then on the other hand, sometimes it is continuing. It happens often, and you can finish that.
that's good. Well, it's actually not my job, it's your job. You did a good job. So Jocelyn basically nailed it. I would probably get a little bit more narrative. Do you want to try it? She did. So sometimes when we see this, it's an isolated event. It's the only time it's ever happened, and there's not much else going on here. And sometimes when we see this, this is just one of many incidents, and it could be going on for weeks or months or years. What's it like for you? So I hope you can see how this approach, some people call it narrative questioning, you can call it whatever you want, but this idea of taking multiple possibilities that are different, usually diametrically opposed, and saying, we see this all the time, this is normal, that's normal, I am not making assumptions. It's very powerful. So where else could you see it in your project? I want to see if you can, on your own, find a place where it could be useful. I could see numerous ways to use this, and we want to make sure it's clear. We don't use this for something like, what did you have for breakfast? Now, some people wake up and they decide, you don't need it for things that don't have emotional charge or social valence. But for things like, when some kids come to the ED, for some of them, it's no big deal. They've done it before. They'll forget about it by, an hour from now. And some kids, it's almost like a traumatic experience. What was this like for you? It's a way to, instead of saying, how are you feeling now, which is a good question, might put them on the spot. So this is another way to use that narrative approach. Okay? So I really see it, because you're actually in a very charged area, both the drugs part and the violence part. You could also use it to inquire about weapons. You guys are being very coy. So the kid used a knife. How else could you use that as a starting point to maybe finding out what other weapons they may or may not have? So I see that you were, in a fight with one of your colleagues with a knife. How could you use that to start the conversation about other weapons?
Some people we find that some people just use knives, but then we also find that people that have knives also have other forms of weapons. What do you use?
Yeah.
Is this the first time?
Yeah, good. Beautiful. So sometimes the only thing they ever carry is a knife. And sometimes we see kids who come with a knife also at home have other weapons or have used other ways or protect themselves in other ways. We could use it in a more positive way just to tell them, I'm not here to judge you, I'm not your mother. But that was very good. Another way we use the long form, and may not be as applicable, is everything in the study single shot, or is there a follow-up call? I forgot.
This particular focus is just while they're there.
Okay. So I'll just mention this because it could apply to your other clinical responsibilities. It's a great technique for following up with someone. So you could say, last time we changed your medication from A to B. Would you say things are better, worse? And the difference here is we put an anchor point of stay the same. And that allows the person not to be forced to choose a change when in fact a lot of the times there is no benefit. So the same with behavioral intervention. So if you were following up in this study as a clinician, not as an assessment person, but you want to say, last time we talked about trying to limit your drinks to 2 at each party so things don't get out of hand. Well, how would that go? Would you say your drinking is, worse, better, or about the same? So the major differences here is when you're talking about change, we have a middle anchor point so they don't feel pressured to have to choose that something has, in fact, moved, because often they would say, I'm sorry, it hasn't. And by eliminating the middle, we often force them to choose, which we don't want. So a couple other cute tricks to have in your arsenal is the typical day question. So typical day is a very nice, efficient way to get the person's patterns quickly. So for your study, how might typical day manifest? Where would you possibly, when you're talking to a kid in the ED, and now they're in the study already, and you want to talk about either substance use or violence, how could typical day or typical week, depending on the frequency of the behavior, manifest? Who would like to try? Sandra said, on a typical day, what's your alcohol use like? Nice, no judgment, there's no demand, beautiful. Where else could you ask it? How about partner violence? How would you want to ask about partner violence using typical day or typical week? How about on a typical day, how many arguments do you have? On a typical week, how many fights do you have? Okay. Now, one thing we can add, I mentioned it earlier, we can say if any or if at all. So if you want to include the possibility that it's 0, you just add if any or if at all to the question. Okay? So it's a good trick. It's just a nice way to start a conversation. Compare to is a very good strategy if you want to try to get the person to see that there's been a change. So one of the ways that we use it is for obesity studies. So docs hate talking about weight. It's really unpleasant for them. So what we have found is they really like using this little trick. So I see today, ma'am, your BMI is X, and it's at the X percentile. How does that compare to your weight maybe a year or 5 years ago? It's a very innocent way to get a conversation started that things may be going north, south, or even. Now for your project, for substance use and for violence, where could you use compared to?
Compared to your friends, your peers at school, if
Mhm.
we're not talking about a time, compared to other people you know or you're hanging out with.
Good. Now we usually use it, although you did it as what we call a normative comparison, we usually, it's a wonderful academic term, an ipsative comparison, which simply means compared to yourself. So how could you use compared to yourself in this project?
Compared to last year, what is your, you know, how much are you using or is your use any different?
Good. And in terms of violence and fighting, how would you use it?
Compared to your previously, how many kind of fights have you?
Good. So compared to the last school you're in, how would you compare the number of fights you're in? It's just a very good way of, like any other question, there's no judgment. You try not to make too many assumptions. You don't really know the answer. And the key thing is to give the person the freedom to tell you in either direction. 0 to 10 and 0 to 100 can be used very effectively. Does anyone want to guess how we might use them? How do we use 0 to 10 and 0 to 100?
On a scale of 0 to 10, where 0 is not at all confident and 10 is extremely confident, how confident are you that you can eat 5 servings of vegetables today?
Good. We also use it to measure how motivated, how ready, or how important this is. So for the Flint project, how could we use 0 to 100 or 0 to 10 around either violence or substance use? Where would it have a role?
So on a scale of 0 to 10, how ready do you think you are to change your drug use?
Good. And another question we like is how important is it for you to get into fewer fights? Or how important is it for you to control your aggression? Or how important is it for you to use less of X? So I want to talk for a minute about closed questions because we don't want you to fear them. And we have found that sometimes we have overstated the harm of closed questions. So it turns out that when we actually have coded them and looked at their effects, there are actually 3 types that have very different functions. So the first type is the one we do want you to fear.
Oh my gosh.
So be very afraid of these. These can cause harm. How do you feel when you read these questions? If you were the patient, how would you feel if someone used these with you? Insulted? Pissed off? Judged? So this is the type we want to change because it violates the rules of patient-centeredness. It makes assumptions, they're judging, they shut you down, they don't open you up. But it turns out there's a type of closed question that we actually want you to use. And it's going to take us a few minutes to uncover the reason for this, but read these if you would. Why do we call these preferred closed, which in other words are saying we want you to use it under these circumstances? What is these circumstances? What is common to these closed questions that makes them qualify for, yes, use them? It's so obvious that you're going to kick yourself. What are the number of possible responses? So if there's only 2, or we'd even say 3 responses that are possible, a closed-ended question is more efficient. But we have to add to it 2 other phenomena that make it a closed preferred. It has to be a single event. It cannot be, and it's very subtle, do you usually vote? That is a bad closed question. But did you vote in last year's presidential election is a very good, because it meets the criteria. There's only 2 answers. Now, in theory, there's always a 3rd and 4th answer. I'll talk about that in a second. But for the vast majority of people, there's only 2 answers. It's a single event, and it's already happened, or is happening as we speak. Notice they all meet those criteria. I will give you $1 million cash if you can take this question here and improve it by making it open-ended. Go ahead. Do you have a driver's license? Make it open-ended and make it better. I'll give you $1 million.
What form of ID do you have?
It's not better. It's not better. You're sorry. You can't. Because it is much more efficient for a single pass binary event to ask a closed. The Bill Clinton exception. Did you have sex with that woman, Monica Lewinsky? Now, we like to think we think Hillary thought that was a preferred question. In her mind, there were only two answers. But Bill, God bless him, had a response that avoided that, and he said, it depends what you mean by sex. So you...
What type of driver's license do you have? Because there's a chauffeur,
Oh, yeah.
you know.
That
Trying.
depends. You're trying. You want that million?
250.
250?
10 bucks,
All right.
yeah. Laura's cheap, we'll just say 10.
Speak for yourself.
We don't eat much.
So in theory, these all have multiple. Going back to the Bill Clinton, I ate a kiwi, but I didn't inhale, if you remember his answer. Okay. So there is a really unique situation where actually why you ask those questions. Now in healthcare, it's rare. We never ask it going forward, for the most part. We never ask it about feelings or emotions. We don't say, did you feel sad about that? That is still a bad question, even though it's in the past. And even though it was one event, it still is an inappropriate use because there are not just two answers to emotion. So we have to be very judicious and not use this too often. It has to be the binary event of a discrete occurrence. Feelings, intentions, and emotions, either backwards or forwards, do not meet that qualification. So we would never ask these, for the most part, about intention or about emotion. All right? Now there's this weird in-between category we call benign. The benigns can all be opened. They all can be improved by making them. What, if any? Tell me how, if at all. But they tend to do something better than the slide 2 ago. These do not function as closed questions. When you ask someone, hey, are things any better since we last spoke? Almost always that will elicit a narrative, not a yes-no. If you look at these, keep in mind there's no snark to these. If these were communicated with snarkiness, oh, did things work out for you? Of course, they would be no longer benign. They would be nasty. But these are all verbalized with empathy and without judgment. And in that form, there's no reason to worry about these. So one of the take-home messages of our trichotomy of questions, particularly of closed questions, is most of the closed questions you ask are actually benign. We've known because we've coded them all. And most people used to get so upset. I ask closed questions. I'm a terrible counselor. Well, almost always it's these, meaning they're harmless. So don't worry about these. The preferred ones we encourage, the nasty ones we want to fix. So I've come up with some questions that all have a subtle imperfection. And I want you to try and use any of the fixes we've talked about. Just to reiterate so it's clear, we do sort of stuff you with big boluses of information. You could use any of these. Hopefully you wrote down one or two that are new. You could use the long form. You could use it with 3 data points versus 2. And you could use typical day compared to 0 to 100. With that in mind, let's attack some of these and see if we can improve them. Who would like to go first? Are you ready to stop getting into trouble? Clearly a nasty, obnoxious, controlling question that would shut down any reasonable patient. How could we improve this?
So on a scale of 0 to 10, how important is it for you to limit the amount of fighting you have at home?
Good. So you went with 0 to 10. That's fine. It works. There's many other ways you could ask. Let's do 1 or 2 more. Come on. One more way to ask this one.
Has your trouble decreased?
So that's a closed question. Oh, well, you can finish it. Go ahead. No, I interrupted you too soon. If you're going to do the second half, it becomes open. Has your trouble decreased?
Increased
Yeah.
or stayed?
Good. So yes, you could use a compare to. So compared to a month ago or whatever time frame, how would you say your fighting is? Is it her fault for making you have to hit her? Is it her fault for making you have to hit her? How could you fix that?
often do you argue with her?
That's a
Or-
frequency question. I want to get at here. It's fine, Gabby. Here I want to get at his attribution for whether or not she deserved it, so to speak. But you want to ask it in a way that's not judgmental.
Help me understand.
Okay, so what makes you hit her? Help me understand. I like those. I think those have the potential to be a shutdown question. So how could you, they're good, but what other strategies have we talked about that you might be able to employ here that might be softer?
How are you feeling before you hit her?
Okay? The problem with something like that, in general, we are wary about questions that demand psychological insight. Not that when they work, they're great, but there's a large percent of the population who can't answer them. But still good. I like it. But I'm looking for a long form here. How would the long form be employed here?
Could you talk about, is it appropriate to say things like, sometimes when people get frustrated, they hit, and sometimes when people, or they take a walk, what do you do when
Good.
you're frustrated?
So that's a good long form for how to handle certain triggers. Specifically here, I want you to reframe this question of, do you think she deserved it? Some people, I'll start it, some people feel that, yeah, either it's okay or that you only do it when they egg you on so much that you have no other choice. And other people feel, no, it's really never justified. Okay, so that's one way to do it. This is very delicate, but this is why we like the long form.
So like sometimes, some people feel that certain behaviors require you to hit someone,
Good.
whereas other people never feel you should hit.
Hear what she said? She
How
said,
do you feel about
that's beautiful. Some people feel that certain behaviors that require you to hit someone to shut them up. I'll just add a little thing. And other people feel, no, they're under no circumstance is there anything she could do that would justify hitting. What are your thoughts? Okay, very good. Do you realize how this is causing you problems? Of course, I'm not assuming any of you would ask any of these. I don't want you to walk out saying he thinks we're an idiot. But these are just things that you could use as triggers to practice our skills. So how could you ask that one better? Do you realize how this is causing you problems?
When, if ever, has this caused you problems?
Okay? I gave you a strategy that got buried, so I will bring it out again. Looking forward 1 year from now, finish it. Looking forward 1 year from now, finish it. Yeah, I would even take away the problem to say, tell me what you think your life will be like. So we want to get away from problems is a little bit of a pressurizing word. So we want to sort of back away and start and try to stay neutral where we can. So, let's say things continue and there's more of this. Tell me about what your life is like in a year from now. That can backfire. You can say, great, I'll be known as the toughest guy on the block. No one will fuck with me. They may say that, but it's still worth asking. Are you more likely to fight when you get high? It's actually a good question. It's getting to the right topic, but we could ask it better. And we're looking for a couple of very specific things here. So, Alex or Amanda, it's your turn again.
Say, when some people get high, they feel very calm and relaxed and that they feel good. Some people get high and feel that it makes them agitated or violent.
That's great.
How does it make you feel?
I like that a lot. We have another very concrete way to handle it. Yours is just as good. Who wants to think of it? I will help you. It has 3 points on the scale. I'll start it. When you when you drink or whatever their drug is, when you smoke weed, would you say you are?
more likely to be violent, less likely to be reason.
Perfect. You hear what she said? Are you more likely to get violent, less likely to be violent? And she did the beautiful middle one, which is, or it has no impact. Okay? It's another way to show your neutrality. It's another way to show I'm not going to pressure or judge you, which is one of the primary initial objectives of MI. And we'll talk about the 3 phases after lunch, but there are actually 3 phases to MI, and the primary goal of the first phase, which we call the explore, is to establish rapport. These questions both establish rapport and also avoid breaking rapport, because some of the versions here would break rapport for obvious reasons. Can you control yourself when you get high? It's similar to the last one, but we'll see if you could use a slightly different type of question to get at it. Can you control yourself when you get high?
I guess the 3-point one again.
You could use that. How would it sound?
When you're high, do you feel like you're in more control of yourself, less control of your actions?
Good.
No.
Good. So you'd also could say, how, if at all, does getting high impact your tendency to fight? So that would be the direct single question. I'm not saying it's better, but it would also probably get you where you need to go. Okay? What impact, if any, do drugs have on your other behaviors? Do you want to keep coming back to the ER? That's a Dr. Phil type question. How would you ask that? And for some of these answers, they're so bad they're not fixable. This is borderline so bad it's not fixable. We just have to throw it away, but let's see if we can try and salvage it from the trash heap.
Does coming here help you at all?
That's closed, by the way, so see if you could open it up. I know you're getting somewhere. You could say, what are your thoughts about having to come back to the ER again? What are your thoughts about whether or not you think you will be coming back here? Let's say in a year from now, you've been here 2 or 3 times. What does that probably mean is going on in your life? I think there are ways you could ask it. Do you think she deserved it? We've done this one, but let's see if we can come back and reconstruct a better question. Do you think she deserved it?
Like, I have a question about that. So, like, could you do a long form where one end isn't actually null or negative?
Let's hear it.
So, when you were angry enough to hit her, did you feel like she had done something to instigate it, or did you feel like you just needed to lash out? That's
So they're not polar opposites. That's fine. They don't have to be opposites.
That's what
Yeah,
I'm trying to
they can just be alternatives. So yes, that would be fine.
But it seems like that question that puts it doesn't focus on the person. Because if you're asking if you think that she deserved it, you're not asking about that person's.
Alicia's, I still think that would be useful to find if they feel she deserved it. That's very useful information to know, even if it doesn't get at some of their inner dialogue.
Because like if they've already hit, then obviously saying some people think it's never okay to hit, like that seems like a silly end point for me because they're not going to think that.
The endpoints are often so extreme that no one would agree with them. So let me give you the example of homosexuality again. Sometimes we even exaggerate. Some people feel it's the biggest sin on earth. It's a complete abomination. It's like dogs, as Rick Santorum would say. We would actually sometimes do that, never expecting them to agree with that. But simply showing if we can go all the way out here, that maybe they would admit that they're here. So it's okay if it's a straw dog. Okay, I know what you're saying, but it's okay if that one, all right? All right, let's do a couple more, then we'll stop for lunch. Is a gun the best way to settle this? Chandel, hit it.
Are there any other alternatives you can think of?
Okay. That's a benign close. So it's technically closed, but it does no harm. Anyone else want to try an open? Although that is certainly going to work. What are there other ways to settle a beef? That you could settle a beef, make it personal. What else?
Some people use a gun, some people walk away. What do you do?
Okay. Yeah, or you could have a middle where some people use a gun, some people use slightly less fatal weapons, and some people don't fight at all. You could have it as a 3-point continuum. Aren't you a bit ashamed of the way you acted? Aren't you a bit ashamed of the way you acted? clearly an obnoxious Dr. Phil question, how would you reframe it? Any of the techniques we talked about?
What are your feelings about what happened?
Yeah, basically that's it. Just back away from a negative, interjected question and just say, hey, what are your thoughts? What do you think happened today, and what's your feelings about what happened today? We'll jump to the bottom one, and we'll take our break. Do you always lash out when someone talks trash about you? Do you always lash out when someone talks trash about you? Anyone?
Say on a typical day, how do you react when someone speaks badly about you?
Good. Or you can say in a typical event, but those are both fine. We're just filling out the margin. So typically, how do you respond? What else?
Typically, I use neutral or do lash out or.
Mm-hmm. How do you respond? Would you say typically, normally you get angry? Yep. Normally it doesn't affect you. May just be 2, but we can do 3 too. We also could, if I were to give you a little bit more clinical information, this is clearly the kid had a big fight, and we talked about this one before, and you have that piece of feedback, you're sitting there, you know this kid is not shown up in your records before, but you're not sure if this is the first time, so how would you ask that? So I see this is the first time we've seen you in Hurley. Sometimes that means blank, and sometimes that means blank, so how would you fill those blanks in? For some people, it means this is the first time they've ever had a problem, and this is the first time things have ever gotten out of hand, and for some people, it's just the first time they've had to go to the emergency room at Hurley. Which is it for you? Okay? All right. So let's go back and look at some questions that could use some work. Does your child take her insulin every day? You're now a pediatrician, you're dealing with this type 1 diabetic kid, and the parent is in the room with you. Does your child take her insulin every day? So there's a special case that we didn't talk about, so I'll bring it up now. When we ask about adherence behaviors, we actually often recommend you ask it in the negatively framed. On a typical day, how many doses does she miss? On a typical week, how many doses does she miss? So it has a particular strategy that it normalizes imperfection. It rarely elicits false negatives. Rarely does a person create fictional non-adherence. So we have found it generally gets better data. So when it comes to adherence, one of the tricks is how many doses do you typically miss? Is her asthma much better? Who would like to do that? Is her asthma much better? You switched inhalers a week ago, and now she has come back with her daughter. Is her asthma much better?
So compared to a week ago, how much better or worse is your
We want to add one other point. Use 2 points. We could use the 3-point scale. So,
or as in not.
right. So she actually did the perfect combination of multiple strategies. Compared to a week ago, before we changed inhalers, we do say her asthma is better, worse, or unchanged. So that's a good combination of 2 of our little tricks. Is she experiencing any side effects I need to know about? Is she experiencing any side effects I need to know about?
How are you feeling?
Good. That's very general, but that would get at it. What would you say?
Typical side effects can include X, Y, and Z, or event are you experiencing?
Mm-hmm. So you're using a little bit of the long form in a way. Some people experience this, some people experience this, and this is what Emerson said. They don't always have to be polar opposites. They can just be reasonable options. Another little trick is if you don't want to ask only about the negative and want to know, you could say, what if any changes has she noticed? What if any changes has she noticed since she started that drug? Have you always been this big? Who would like to fix that one?
Compared to a year ago, are you bigger or smaller or something?
Yep. Or how would you compare your weight to your weight a year ago or 5 years ago? Are you worried about your weight?
compared to 0 to, or not compared to, but like on a scale from 1 to 10.
Mm-hmm. Finish the
0
thought.
being not worried at all, 10 being very worried. How worried are you about your weight?
Good. you understand how painful this is to others? This is someone who either bullies or gets into fights.
How, if at all, do you think this affects your boyfriend?
Nice. Did you send that picture of her just to get revenge?
Let me understand how this picture of her made you.
But he sent a embarrassing picture to all of his friends of his ex-girlfriend. And the counselor is asking if he did it to get revenge.
Help me understand why you sent this picture.
Okay? Now, this is a classic case where a lot of people are down on the why question because it can feel like you're being trapped. So although it's okay, there are other ways you could ask it. So okay to ask, tell me why you did it, but think if you could soften that a little bit with either the long form or some other strategy.
What were you hoping to accomplish
Oh, that's good.
by sending this picture?
It gets away from the why word. I'll help you. Some people, when they send pictures around of their exes, do it just because they're trying to be funny or they think their friends will find her hot. And other people do it to really try to punish their ex or to embarrass them. What was going on in your head? Okay? Do you know that you can be thrown out of school for this?
What, if any, consequences do you think will come of these actions?
Good. And we have to be careful. That question could easily migrate into controlling, so you have to be really careful with tone on that. Have you always been so mean to other kids?
How do you feel about other kids?
We refer to that as, we want our questions to be the right depth and breadth of the net. In this case, we say you were fishing for salmon and you caught Asian carp.
Oh, an Asian carp.
Yeah. So.
It's a keeper.
So be slightly more focused, even though that was fine. Your net was a little bit too deep and broad. Okay. Okay. Yeah. Compared to could be used here, or you could say how typical is this for you. Both of those are very good. All right. Let's do a couple about substance use, and then we'll do our last little bit, and we'll get on to reflection. So, you always use condoms.
Would you say you use condoms 0, 50%, 100% of the
Good.
time?
So you're basically taking a continuum. Instead of 0 to 10, it's 0 to 100%. That works. There are a couple other strategies for this. Anyone else want to try? It would be a long form question, and the sort of the nuance is what are the poles here, or what are the 3 points on that continuum? I'll help you. Some people never use condoms with any partner. Now you have 2 more points to fill in. Some people.
Use a condom all the time.
And then what's the middle one?
Oh, once in a while.
Yeah. So now what would be the end of that? It's obvious, but how would you finish that? What would be your icing on the cake?
What would you pick? How often do you use
Yeah.
condoms?
What's it like for you? Where would you put yourself? How would you rate yourself? Do your parents approve of you being gay? How could you ask that slightly differently?
How do your parents feel about you being gay?
Yeah, that's pretty much that simple. You're just going from pure closed to open. Let's talk about smoking for a second. It could be used for almost any drug, but we could say right here, have you been successful in your prior quit attempts? So this could be for any substance. Have you been successful in your prior quit attempts? What would be the fix to that? Too close, too narrow.
Tell me about the times you quit in the past or the times
Mm-hmm.
you tried to quit.
Good. What does work for you is a good question. It wasn't on our original list, but we'll get to it. What works for you, or on the days where you were able to abstain or to resist, what was it like for you? All right, here's how we're going to close this out. I want you all to write down 2 things, and then based on those 2 things, we'll know that you're ready to move on to reflection. The 2 things are an open question you could use. For those of you who are in Safer Teens, have it focus on that project. So it'll either be on dating violence, some sort of aggression, or substance use. For those of you who are here for other projects, choose any health issue. So write one good open question that we have not yet used. So create a new question relevant to your domain. Second, and this is much harder, but we want you to try, create a closed preferred question. To remind you, closed preferred are the ones that are seeking an answer that is binary, such as did you close the garage door? Do you have your driver's license? Do you have your insurance card? Think of a closed preferred question you could ask for your projects. The second one is much harder than the first, but try to get both. Start with your open, then see if you can get a closed preferred that's relevant to your project. Let's go ahead, take about 5 minutes, and we'll share them with the group. Okay, let's go around the room and hear what we have for your open and your closed preferred. Who would like to go first? Sandra's going. She's been voluntold.
For the preferred clothes, which made it hard for me to think of.
They are difficult.
Have you experienced any difficulties in the last?
Okay. Yes, that technically meets the criteria. It's just a little bit, as I say, true but useless information. Have you experienced any drug use in the past week? It's okay, but it would need more drilling down. What's your open?
What is your drug use now compared to last year? Has it decreased, increased?
Good. So she used that classic combination of compared to and used the 3 category of up, down, the same. Very nice. Next. Shandell.
How, if at all, have you been injured as a result of physical violence?
Good. So use the if at all. And what would you do for your closed preferred? Did you find one?
I didn't finish it. It just have you ever had a broken bone as a result of?
Good. Single past
Yeah,
event.
sure.
Good. It actually meets the criteria. Next.
Compared to a year ago, how often are you getting in fights at school?
Good.
And then I put, have you ever planned a fight at school?
Good. Past event. Next. So far so good. We're 3 for 3. Laura?
Some teenagers use cutting as a way of feeling less emotional pain, and some teenagers just like to talk to someone. How do you deal with your emotions?
Great.
And then I tried to make one with, did you use a condom the last time you had sex?
So what you did that's so smart is you limited it to the last episode, and therefore it becomes a good closed question. If you said normally, it doesn't work.
Right.
So that proves you got it. Next. Holly.
She's like, have you used marijuana within the last month?
Yes, that works.
The other one I'm kind of in the middle of, so.
Okay, when it hits you, you scream it out. Let's get a few more. Tiffany, what you got?
I was gonna say, tell me how you've been managing being a newly diagnosed diabetic. And then my number 2 was, did you fill the prescriptions ordered by your physician during your last visit?
Perfect. Next. Shamina?
Compared 3 months ago, how are you feeling with your health now?
With your
Health.
health. Good. Next. Diane?
On a scale of 1 to 10, how ready are you to cut down on your
Okay.
and then do you have any plans to do that in your own life?
Normally we say intention should not be binary. With this is the exception. So talking about self-harm, we sort of change the rule and go to binary. So it works. Next. Did you go yet?
Oh,
Okay.
no, I didn't. So first one, tell me more about what it was like for you the last time you got in a fight.
Okay.
And then second one's very similar to Laura's over here. The first time you had sex with your boyfriend, did you use a condom?
Single episode. Good. Alex, did you go yet?
No. So saying maybe looking forward, how do you see yourself handling bullying situations at school?
Good. So looking forward, that's a
I
nice.
didn't get to a close one.
All right, they're harder. So now anyone randomly? Emerson, did you go?
I didn't go. Help me understand what you were thinking just before you got high last time.
Okay.
were you high the last time you got into a fight?
Good. Single past episode. Shannon?
Mine's a dietary question because I'm working on a FODMAP project. Some people come in without any prior knowledge of FODMAPs or how they impact digestion. On the other hand, some people come in with a thorough understanding of FODMAPs and how they impact the digestive system.
You have to tell people what FODMAPs are.
So FODMAPs are carbohydrates that ferment differently in some people's colon than others, and so they produce symptoms. And some people are sensitive and some people aren't. And then my benign close-ended would be, are you sensitive to FODMAPs?
Good. Yeah, that technically meets the criteria. It's not an event, but it's a yes/no phenomenon. Okay, anyone else want to go? Did you go yet?
No. I was hoping it's gonna be. Anyways, so.
Honesty comes diet project too, so I just did it with Dad's 12-week shake program. So the first question, the closed open or the closed question for you guys, the second one is, did you follow the shake diet yesterday?
Okay.
And then another question is, since starting the diet, have you felt worse, same, or better?
Okay, good. So, last little thing. If you do ask a closed question and they don't elaborate on it and it actually functions like a closed question, these are just a series of prompts or probes that will dig you out of a closed-ended hole. So almost always, if you happen to err and ask a closed question that does elicit a yes/no, these are just sort of the classic probes that will get at what you would have gotten at if you started with an open question. So it's rarely the end of the world. It rarely breaks rapport. So do you have any questions about closed questions? What questions, if any, do you have about open questions? Some people find this part of the workshop really easy. Some people find it really hard. Some people couldn't care less. What, if any, questions do you have? Compared to how you were 3 hours ago, how would you rate your skills right now?
Uncomfortable.
I have a question. Can you say, do you believe that this will help you? And is that like a good close?
It's closed, but it's okay.
Okay.
It's okay. How do you feel about it? Would be
Yeah,
similar.
just a feeling of it. Okay.
Any comments, questions before we leave it?
How do you feel?
It elicits more than a yes/no. So, oh, it's open.
Open,
It's
open.
open. Yeah.
Okay.
Yeah.
Right.
It's open. I think it's a do you feel, but if she, how is open. If I said it was
Do
closed.
you believe?
Yeah, do you believe is closed. How you feel is open.
If you
All
say,
right.
are you feeling better than 3 months ago? It's close.
That is closed. It's not a bad one. It's one of those that we'd have to say is harmless, but it's still technically a closed question. How do you feel compared to last year is open.
But this is closed.
Are you is closed.
Yeah, I am trying to do the closed.
Okay?